Hello everyone. Today we are discussing about definition of cognitive behavioral therapy (CBT) and its technique with example. CBT stands for cognitive behavioral therapy, which is a form of psychotherapy that helps people identify and change negative patterns of thinking and behavior that may be contributing to mental health problems. CBT is typically a short-term, goal-oriented approach that involves working collaboratively with a therapist to develop strategies for managing and overcoming mental health challenges. Techniques used in cognitive behavioral therapy, CBT, along with examples of how they might be used. Cognitive restructuring. This technique involves identifying and challenging negative thought patterns that contribute to emotional distress. The goal is to replace negative thoughts with more balanced, rational ones. For example, a person with social anxiety might have the negative thought, "Everyone is judging me and thinks I'm a loser." The therapist might help the person challenge this thought by asking questions like, "Is it really true that everyone is judging you? What evidence do you have to support this thought?" Behavioral activation. This technique involves encouraging individuals to engage in activities that are enjoyable or meaningful, even if they don't feel like it. The idea is to break the cycle of avoidance and withdrawal that can contribute to depression and other mental health problems. For example, a person with depression might be encouraged to make a list of activities they used to enjoy, and to try to engage in one of these activities each day, even if they don't feel like it. Exposure therapy. This technique involves gradually exposing individuals to situations or stimuli that they fear, to help them overcome their fears and build confidence. For example, a person with a phobia of flying might start by looking at pictures of airplanes, then progress to watching videos of planes taking off and landing, and eventually work up to taking a short flight. Relaxation techniques. This technique involves teaching individuals to use techniques like deep breathing, progressive muscle relaxation, or visualization to manage anxiety and stress. For example, a person with generalized anxiety disorder might be taught to practice deep breathing exercises when they feel anxious or stressed. Mindfulness-based techniques. This technique involves teaching individuals to be more present and aware in the moment, without judging or reacting to their thoughts and feelings. For example, a person with depression might be encouraged to practice mindfulness meditation, which involves focusing on the breath and observing one's thoughts and feelings without judgment. These are just a few examples of the many techniques that may be used in CBT. The specific techniques used will depend on the individual's needs and goals, as well as the therapist's approach and training. CBT is often a collaborative process, with the therapist and client working together to develop and implement a treatment plan that is tailored to the individual's specific needs.